Namaskar, Adab, Sat Shri Akal. I'm Archita Puranik and you are watching Healthcast. World Heart Day is celebrated on 29th September every year to raise awareness about heart health and cardiovascular diseases. Today in our studio we have Dr. Ganesh Nallur, a renowned cardiologist from Kauvery Hospitals, Bengaluru. And we'll be having some heart-to-heart conversations with him. Welcome, Doctor. Welcome to the podcast.
Thank you for having me today.
Let's begin with the most important question. How do I take care of my heart?
Yeah, I think that's the most important question because we always say prevention is better than cure. So I always say don't get to me. Once you get to me, you're already too late. So always try to avoid getting to me. Basic mantra is diet and exercise. So that's the main thing. So keeping a healthy life. And in terms of dieting, we'll probably go into it in detail, but I would say try and follow diets which you can look at it in a long term. Never go for any crash diets, or say never go for a diet which has a name in it, because you can't follow it for more than 3 months. And the same thing with exercise also. Inculcate a kind of a situation wherein you can follow the exercise regime for a long term. So try and make it like maybe sociable, so do it with friends, or do it some sort of exercise which is more of a sport rather than just going to the gym. People go to the gym, get the membership on Jan 1st, and most of them don't go beyond February. So we see that very commonly. So what we say is, it's like don't get scared of heart and then suddenly do something. The human body or the mind is something which sort of get used to it, because after 2 months you'll think, oh, I'm bored, and then you'll do something else. So anything, if you want to make it a habit, make small changes and make it in such a way that you can look at it in terms of following it for years rather than just doing it for some time.
So being physically active is the solution.
Yeah, absolutely. See, what has happened nowadays is we feel that we are an advanced society now. Everybody is earning better. Everybody's quality of life is supposed to be better. But if you see the amount of physical exercise that we do is become very, very less. Everybody has a vehicle, either a car or a scooter. You just get out of the house and then hop onto your vehicle, then get to the place of work. Whereas if you think about our probably even our parents' generation, they'll probably take a bus. At least they'll walk till the bus stop and then get down in the bus and then walk again. So at least some physical activity would be there. But whereas we have become proper cowspirators, get to the office, and once you're there, lots of meetings, everything, you're just sitting the whole day. And then the problem is you're sitting, but a lot of work is given to the mind. So mind requires a lot of, brain requires a lot of glucose. So you consume a lot of glucose and you feel that you're tired at the end of the day. But you're not done any physical work actually. It's all sort of mental work, and you end up eating too much as well. So there are lots of simple things that you can do even at place of work. Like say always don't take the lift, take the stairs, and always try to take a break. Whenever you want to contact a colleague, instead of picking up the phone and calling them, just try and walk to their desk and try and do that. And always these coffee breaks, try and walk a little bit and go to the canteen next door rather than just ordering coffee sort of where you are. Once you start doing that a few times, it becomes a habit. You'll never look at the lift, like if you start taking the stairs. But if you're used to the lift, you'll never take the stairs. So try and make it a habit and make simple changes which can be followed a long time.
Great. There's another important question which I think normal people don't understand is how to identify a heart attack.
Yeah, that's a very great question. I would say it's identifying a heart attack is very, very difficult. I would say it's not something very simple. Even now we find, unfortunately, I still get a lot of patients who think it's gastritis or acid or gas as what we call.
Actually, I was gonna come to that question, how to differentiate between a gastric pain and a heart attack.
Let me tell you very honestly, I've been a cardiologist for more than 20 years. If I get a heart attack or a gas, I won't be able to differentiate it just by the symptoms.
Okay.
So because the symptoms are very similar, if you look at it anatomically, so just going sort of theoretically wise, our foot pipe and heart are in the same place. Okay, so the foot pipe comes behind the heart. So the nervous supply and all is sort of similar. So you can get mistaken because symptoms are very similar. You get the pain in the same place, and sometimes you get this burping and all that associated with heart attack, which can all be the same symptoms that you get with gastritis as well. So the things to look for is Main thing is if you have any new symptoms. So if you never had gastritis in your life, you suddenly can't get gastritis out of the blue. And the symptoms of a heart attack are very severe. So you can get pain either in the center of the chest or in the backside. You can get pain in the arms, jaw. So the position of the pain can be widespread, and it's associated with other symptoms also. So you may feel sick, so you may feel like vomiting, you may suddenly sweat, and you'll feel extreme fatigue and breathlessness. So it's one thing is it's associated with other symptoms. It comes on suddenly, and you may never have had any symptoms like this. So what I'll suggest is if you have any new symptoms, always take it seriously. It may still be gastritis, but always get it checked out. So if you the simplest way of getting to know is to getting it checked out. So alarming signs are sudden sweating, severe pain, feeling dizzy, feeling very fatigued. Those are definitive signs that it's probably a heart attack. And if you've never had gastritis, don't think that suddenly you'll get gastritis.
What if someone has gastric issues and they get heart attack? How do they differentiate?
Again, it's very difficult. So if your symptoms are very similar to what your gastritis symptoms are, and if you've got your heart checked out, so even if you're getting gastric symptoms, you have to get your heart checked out. If anybody comes to me, and even if I feel clinically that this is all probably just gastritis, I will say first let's check your heart out, do the basic investigations, ensure that there's no underlying issues, and then only sort of say okay, this is gastritis and not that. So if somebody has got gastritis, look for any slight difference in the symptoms. So normally if you get tummy ache, now you're getting pain in the center of the chest, or you never had sweating, suddenly you get sweating. So look for any changes in the symptoms. If it's very similar symptoms and you take some medication, it goes away, it is fine. But any change in the symptoms, or you're worried, or you fatigue is something which is ignored, in the sense you'll feel suddenly drained out of energy. Okay, with gastritis you will never feel that, but if you're having an MI, suddenly you feel very tired and sort of fatigue. That is also an important thing to look for. So look for any change in symptoms, and always consult your doctor. That will help.
So I'll come to my previous question. How do I identify if there's a heart attack to me or to someone else? You answered that, but if it's happening to someone else, how can I help?
Yeah, that's also very important. So let's say if you are thinking that a colleague of yours suddenly says, oh, I'm having this central chest pain, I'm sweating, I don't know what's happening.
Yeah.
So the first thing is ask them to stop what they're doing, try to get them to rest. So either sit down or lie down. And if available, ecosprin or aspirin, what we call as 300 milligrams of
Blood thinner.
Yeah. That should be given to anybody. So that is very simple tablet, but it's very effective and it can save lives.
Can it be given to anyone in that situation?
It can be given to anyone.
Okay.
And I know people will be worried that aspirin is associated with gastritis, but that isn't more in when you take it long term. So a single dose of 300 milligram aspirin won't cause any major harm. So even if it was gastritis and if given aspirin, nothing will sort of happen, just a single dose. So a single dose of 300 milligram aspirin can be given, and then try and get urgent medical help. So try to get an ambulance to get them to the nearest hospital. So what I say is, both at the place of your work and also at your house, try and find out which is your closest heart center. So that is something, because always when emergency strikes, you don't know when it strikes. At that time you can't think. You won't know, is this hospital closer or is that hospital closer? Because there are some very good statistics on this. So anybody who has a heart attack, if they're not in hospital, the chance of survival is only 50%. So if they get to the hospital, the chance of survival goes up to 90 to 95%.
Okay.
So just by getting to the hospital alive, you will increase your chance of surviving by more than 50%. So that's really amazing. And the reason for that is because when anybody has a heart attack, they get this abnormal rhythm, and that can stop the heart suddenly. So if that happens inside a hospital, we can give the shock treatment. You've seen it in all the medical series where they give a shock and then revive the patient. So that is possible in a hospital setting. Whereas at that time, if it happens while you're outside, then the person sort of dies within sort of 5 minutes. You don't have much time. So by the time they get to the hospital, they are no more. So very important to get to the hospital alive.
Curious question. Does CPR helps in this situation where they cannot get to the hospital?
Yeah, absolutely.
And the heart
absolutely. There are lots of instances where maybe that abnormal rhythm sort of can slightly get corrected, but if you're able to give the CPR and ensure blood flow to the brain is there, then that definitely helps.
Okay.
So training in CPR for everybody.
Yeah.
Nowadays, the other thing I'm sure we'll touch upon that younger people are getting it. So young people don't think you've got gastritis. So young people is more dangerous.
Yeah, actually I was gonna come to that question only. Why are youngsters getting, and like so many youngsters getting heart issues and heart attacks these days?
Yeah, it goes back to my initial thoughts where I said, we've become a westernized sort of society and westernized culture. So, and everybody is competitive, trying to get up in their ladder of success. So, on trying to get into that, everybody is trying to work really hard. There's a lot of stress involved, and unfortunately, they work very long hours and very odd hours. Especially you see the IT people, sometimes they work on the US timings and UK timings, so they'll work all night and then sleep at odd times during the day, so their sleep pattern is bad. So sleep is now being recognized as a very important factor. So they say you have to sleep at least 8 hours a day minimum. You should try to get that much of a continuous sleep, not sort of napping 1 hour here and there and then thinking that's enough. So try to get at least 8 hours, 6 to 8 hours of full sleep. 8 hours is the best. So at least 6 to 7 hours at least you should try to get. And nowadays there are some evidences to say that lack of sleep may be as bad as smoking. So that is very important. So I know you want to succeed in life, but if you sleep well, you'll be more active. That's the other thing you should think.
People think that sleeping is wasting time.
Yeah.
It has become a notion like that.
And people think you should work long hours only, then you can be successful. You have to manage your time better. I think that's what you should look at. So sleeping is very important. So managing the stress within your working environment is very important, and trying to sort this stress by smoking. They say I'm stressed now, I need a cigarette, then I can get my head around it. See, when they get into a problem, that's what most people do. Oh, I'm not able to sort this thing out, let me have a smoke, and then somehow I'll get the idea. So it starts off with 1, 2, and then that becomes a habit.
It never stops.
And it becomes a habit, and then after every half an hour you don't have a smoke, you start sort of having withdrawal symptoms. So that's how smoking also starts. So it's all very interrelated. I'm not saying that people shouldn't be competitive and people shouldn't try to be successful in their life, but you should also know that health is a very important aspect, because lots of young people have lost their lives or even become a situation wherein they're alive but they're in a situation where they can't work very well and all of that. So again, all you're trying to do is succeed, but if your health goes, then everything else takes a back seat.
I used to think that if I'm not feeling sleepy, that means I'm not tired enough and I don't need sleep 8 hours. So I can be maybe okay with 6 hours of sleep also, because I didn't do much during the day. But I think that's wrong, right?
Yeah. See, and also the one important point there is, if you have good physical exercise, so if you exercise well, then your body is tired and you will go to sleep. If you're not done any exercise, then your body physically doesn't say that it needs the rest, and the brain is probably hyperactive because you're trying to solve a lot of issues. So again, exercise will help. If you exercise well, your body will be tired and you will sleep.
There's another question. Is heart issue or heart health issues genetic, like diabetes is genetic? Is it genetic, heart issues?
Yeah, absolutely. So there are certain conditions, genetic conditions, which predisposed. So in many families, it runs in families. So you will see that all the siblings or their parents or one side of the parentage, so either the mom's side or the dad's side, if you ask their uncles and aunts, everybody has had problems at a young age. Maybe if you look at this generation before that, they would have said, we don't know what happened, but at a young age they suddenly died. That would have been undiagnosed. And then their parents, it would have been at least diagnosed, and they have had angioplasty or bypass in their 30s and 40s. So there are conditions like that. So what we would say is, those people should be more hyper vigilant. There are conditions of hypercholesterolemia which runs in the family. So you check your cholesterol, and if your cholesterol, in those people, the cholesterol will be very high. It can go up to 300, 400, 500 like that. So in those people, you have to have specialized treatments to try and prevent you from getting it at the same age. One thing, unfortunately, what you noticed is in these families, they all get at similar age. So once they're starting to get to that age, they start getting panicked and scared and all of that. But we can do what we can from our end, in that you have to be more vigilant. So your other risk factors you have to try and be very careful about. So make sure definitely no smoking in those sort of people, and manage your stress and check for diabetes, hypertension. So control all those risk factors more vigorously. So genetics is an important part. But what I would say is genetics is not the only cause in all the young people.
Okay.
Because we're seeing a lot of young people in their 30s, especially me. I work in Electronic City where a lot of IT crowd is there. I see people in their 30s and 40s come with heart attack. But if you see their parents come with them, they're healthy. But it's the son who's had the heart attack. And so you can definitely know it's not genetics.
It's the bad lifestyle.
It's the bad lifestyle.
Okay, that's concerning. 3 things we do that is good for our heart health, and 3 things we do that is damaging our heart health and we don't know about it.
So if you look at 3 things, again I go to the basic thing is diet. Okay, so good diet, and if I want to go slightly deep into the diet aspect itself, I tell people that again, don't go for any fad diets or any name diets, or try to change whatever you're doing. The simplest and the first and foremost thing which everybody can do simply and easily is stop eating outside food. Okay, so
That's impossible, doctor. That's not possible. Can we, I mean, seriously, it's not possible, but can we moderate it? Like,
yeah, you see, you should try to moderate it, but if you see any outside food, there are 2 things. One is that they'll always be high in calorie counts, in amount of salt and amount of sugar. It's all very high in calorie. And if you actually look at the outside food, any food, if you take it, take away whatever you're doing, after 12 hours it'll be totally unpalatable.
yeah, true.
You
Even if
really,
it's junk, even if it's
whatever
Indian.
it is, you may enjoy a pizza which you have taken now, but after 12 hours it will be really bad. Whereas home cooked food,
It won't be
after
that
24
bad.
hours also you can just reheat it and eat it, because of what all is there in the outside food. So if you really want to see, being humanistic, I'm telling when I say stop eating outside food, it means that it shouldn't be once a day or twice a day. Maybe once a week as a treat you can sort of have it. And the other thing is, if you start cooking yourself, okay, you're spending some time, but you're also looking at what you're cooking and all of that. So that'll also help. So you are going to make that a habit, and you start enjoying your cooking. Then you can still make all those stuff that you buy from outside, because all the ingredients are available. So it doesn't mean that you have to only cook chapati, sambar and rice. You can make Mexican food, all kinds of food can
But
be
home.
but
at
home,
home,
because then you can control the amount of salt that you put, and you don't know what kind of other ingredients and artificial colors and stuff that are put. Sometimes you eat something, your hand becomes sort of red in color,
And it doesn't go.
it doesn't go on. You're right, it's on the hand, it's causing so much problem, and I've eaten it. So what actually it causes, you're worried about that. So that's about diet. And again, eat lots of fruits and vegetables. When you're dieting, important thing is to not keep yourself hungry. Okay, so most people will say, oh, I'll cut down, I'm eating 3-4 chapatis, I'll start eating 1 chapati, and you're struggling, you're trying to drink lots of water and stuff like that. Try not to starve yourself, because how the human sort of brain works is, if you're starving yourself, you end up compensating somehow. So your brain will always make you eat somehow more, and you end up eating more. If you're hypoglycemic, it's always like that. It's a survival mechanism. See, at the end of the day, the basic funda is survival. So if you're hungry, the body is thinking that, oh, you're going to die because of hunger, so it will always try and eat more. So to try and cheat, you have to try and eat more of veg. So sabzi more than the chapati, and eat lots of fruits like that, so that your stomach is filled but with lesser calorie. So that's how you alter the diet gradually. So not from going from 5 chapatis to 1 chapati. So say reducing it to 4 and eat more. You are still feeling full. And once you start exercising, the other thing that you notice is your appetite also comes down when you are exercising, actually, if you do exercise well. So that's our second point. That's 3 points.
Yeah.
So diet, then the second one is
Exercise.
exercise. So exercise, I told you, every person should plan to exercise at least 4 to 5 days a week, at least an hour. So you can split it into half an hour in the morning and half an hour in the evening, and try and make it a social thing. So lots of sports are available now. So try and go with your friend, make a group. Okay, the advantage of a group is if you are not motivated today, somebody else will call you and say, why you're not coming today, you come. Or if you don't come 2 days, they will try and push you. And it should be, if it's sports, again it may be competitive, so you're wanting to win, you lost the previous day, or you're not playing as well, so then you will be motivated to improve your fitness to try and play well in the sport. So that is an advantage. But if somebody doesn't want sport, again, even in terms of brisk walking, jogging, cycling, nowadays we are seeing a lot of people, they never run after 40s, they're running marathons and things, but that's because they're in a sort of a group and getting motivated. So do it in such a way. Joining the gym, I'm not sure how
it usually fails. It takes a lot of self-motivation, push to go.
Really motivated people, will do it obviously, but I feel that that is less number of people.
That's not the majority, for sure.
If you take a normal person, I think gym is a failure. Everyone would have tried that. Even I've done that. You join a gym on January 1st because you made a resolution. By February, it's you've paid for 1 year subscription. It's gone.
True.
So that's the second point. And then the third point is, I was telling you, sleep. See, smoking, obviously smoking everybody knows, but sleep is something which we have to make people aware of. So at least we should say 8 hours, so at least they'll make 6 to 7 of continuous sleep. And it should be in the night only. So you know, some people work odd hours, but whatever, at least you should make sure you have 8 hours sleep. That is very important, because when you're sleeping is when the body regenerates its energy, and also a lot of the cells which are damaged, they get rejuvenated when you're sleeping. So good sleep is very, very important. And as I mentioned earlier, now they're saying that it's probably as bad risk factor as smoking. So you can imagine, if you don't sleep, it's as bad as smoking. That can be worrying.
What is the right frequency to get heart tested for a healthy person who wants to be aware of their heart health?
So see, basically we'll say the tests should be probably we used to say after 40, nowadays we're saying even after 30, because we're seeing more young people. So yearly for a preventive sort of health checkup. Important things to check are your blood pressure, your diabetes, whether you're diabetic or not, because even if you're not diabetic, you may develop it in a year. So usually in a year, but if it's borderline, obviously the doctor will tell you to do it. But as a general rule, your blood pressure, your check for the diabetes, check your cholesterol, and basic heart tests are ECG, echo, and a treadmill test. So those are the things that you should probably do it once in every year. So that's the sort of preventive health checkup that is recommended. Normally after 40, but nowadays probably after 30
after
also.
30,
because we are picking up a lot of, nowadays a lot of health checks are also there, like every workplace they have their own routine health checkup, so BP and all that is checked, and we are picking up every time young people in their 30s and 20s with hypertension. So hypertension also has become common. So they are developing, the risk factors are also happening at a young age. So if a 40-year-old comes with heart attack, you will say, oh, I've been taking blood pressure tablets for 6-7 years, sugar tablets for 3-4 years. So this risk factor profile we would never see. And I think it's our lifestyle. I don't know, not a very easy answers for a lifestyle, but we have to try and balance it out as much as possible.
That's it from my side, Doctor. Thank you so much for making time and joining us today. Stay tuned with us for more such health content and amazing interviews like these.